Hello everyone, welcome to another educational video. Today, we are going to discuss how to manage osteoporosis. We will explore what you might expect from a consultation with your GP and the simple strategies to improve your bone health. You cannot see or feel your bone loss. It is a silent condition, and you may be alerted to it from an X-ray for something else or after you sustained a fracture. In this video, we will explore what is osteoporosis and a holistic approach to keep your bones stronger for longer. Let us look at these scenarios. You clerked in a 67-year-old female who tripped while going into her door after walking her dog. The fall resulted in a fracture of the left lower leg. She was admitted for manipulation under sedation and POP application. She is postmenopausal and not on HRT. Medical history includes essential hypertension and type 2 diabetes. There is no prior history of fragility fracture. What do you think happened next? She was referred to her GP to discuss bone health. Imagine you are at the receiving end of this discharge letter. How would you manage her? Here are two more cases to reflect on as we proceed. Patient 2, 68-year-old man admitted after a first-time fall with a right neck of femur fracture. He underwent a right hemiarthroplasty. The fall happened outside his home. While walking on the pavement, he tripped and fell. His medical history includes type 2 diabetes, irritable bowel syndrome, and hypertension. His alcohol intake was within sensible limits. Once or twice a month, he takes a glass of wine. He was started on vitamin D maintenance because he had received vitamin D loading while he was in the acute hospital soon after his hip operation. He now mobilizes with a four-wheeled walker. Patient 3, 74-year-old female with stable osteoarthritis. She has a history of heart failure, peripheral vascular disease, and leg ulcers. She had a fall in her bathroom but had not sustained any bone fractures. She has had a few near misses while walking with her Zimmer frame, where she caught herself on the wall, but this time balance was more shaken. She reported intermittent muscular back pain that improved with analgesics. She was noted to have extremely low vitamin D that needed treatment. Otherwise had an uneventful stay and was discharged to her GP to discuss her bone health. Here are the key points we will need to cover. I would go through them broadly, then we can take them apart, piece by piece, to see what details we can uncover. 1. Arrange vitamin D testing and calcium intake assessment. In the 3 cases mentioned earlier, they all had vitamin D deficiency and received treatment. 2. Assess fragility fracture risk using the FRAX score or Q fracture score. Consider arranging a Dexa scan if appropriate. 3. The current guidelines recommend a fragility fracture risk threshold of 10% to indicate the need for a dual-energy X-ray absorptiometry scan or Dexa scan. 4. Based on patients' preferences and commodities, if the osteoporosis is confirmed, discuss bone-sparing therapy. 5. If bone density is low but not in the range of osteoporosis, rescan in a minimum of 2 years or based on clinical judgment. 6. Follow up early if on bisphosphonate, asking for reflux symptoms within first month. Reconsider ongoing need for bone-sparing treatment after 5 years or sooner if another fracture occurs. 7. Readdress advise and support for lifestyle modifications. Regular exercise, balanced diet, alcohol limit, smoking cessation, provide information leaflets, and use social prescribers to connect patients to community support. These cases test your understanding of the management of bone health. Patients would benefit from discussing bone health with a GP. I hope this video will offer you a reliable resource to have these conversations more readily, either as a patient or a clinician. A typical consultation should gather information about previous falls and fractures and their past and ongoing medical conditions that can impact bone health. Apart from the natural process of aging and menopause, several medical conditions and medications can cause more rapid bone loss. The most common conditions are hyperparathyroidism, hypothyroidism, vitamin D deficiency, and celiac disease. And the most common medications are long-term use of steroids, proton pump inhibitors used in treating indigestion, antidepressant medication class called SSRI, anti-epileptic medication, and estrogen blockers used in breast cancer. Additional history should assess suitability for the medications used to treat osteoporosis. Ask about any pending dental work and any conditions that affect swallowing if you are considering bone-sparing treatments. This is because these medications can cause irritation of the esophagus, and there is a serious but rare risk of bone death of the jaw, which can present as pain and limited joint mobility in the affected area. Ask about lifestyle factors, diet and exercise, alcohol, and smoking history. The sign guideline recommends that even in frail elderly women, aged 80 or over, a Dexa scan would be a prerequisite to establish that bone mass density is sufficiently low before starting treatment with bone-sparing agents called bisphosphonates, unless the patient has suffered multiple vertebral fractures. In these fictitious cases, all the patients were treated for vitamin D deficiency and eventually diagnosed with osteoporosis. A follow-up appointment discussed the role of bisphosphonates and a review of lifestyle changes. What is osteoporosis? The two main characteristics of osteoporosis are the presence of low bone mass and structural deterioration of bone tissue, which increases the fragility of the bone and susceptibility to fracture. Osteopenia is the stage before osteoporosis. You need the result of a bone density scan to differentiate the two. The results of the Dexa are presented as T-scores, which is a statistical number that represents how dense the proximal femur and spine bones are in a patient, compared to the average bone density of a healthy 30-year-old. The other number you may find is a Z-score, which compares your results with people of the same age as the patient. We rely on the T-score to make a diagnosis of osteoporosis. If there's a negative sign in front of a number, then it is less dense. If there is a positive sign before a number, then it is denser than that of the average 30-year-old. The cutoff for the diagnosis of osteoporosis is less than or equal to -2.5. Osteopenia ranges from -2.5 to -1. Normal as compared to an average 30-year-old is greater than -1. What is a fragility fracture? A fragility fracture happens when you fracture a bone falling from a standing height or less, or a fracture from low trauma incidents. Fragility fractures occur most commonly in the spine, hip, and proximal thigh bone, wrist, and distal forearm. There is a direct correlation between osteoporosis and fragility fractures. Osteoporotic bones are more porous and brittle, making them more susceptible to fractures. The most common fractures associated with osteoporosis are hip fractures, vertebral fractures, and wrist fractures. These fractures can have significant consequences, causing pain, disability, and a decline in overall quality of life. There is a considerable number of osteoporotic fractures per year in England. You can get advice from your GP about strategies to prevent complications of osteoporosis, which can cause lifelong morbidity and mortality. Part of the Quality Outcome Framework, QOF indicators, require the GP practice to establish and maintain a register of patients in two age groups, those aged 50 or over, and who have not attained the age of 75 with a record of a fragility fracture and a diagnosis of osteoporosis confirmed on Dexa scan, and those aged 75 or over with a record of a fragility fracture and a diagnosis of osteoporosis. Your GP would select from a few risk assessment tools to predict a fracture incidence over 10 years. Based on your score, it will be used to aid decision-making. Bear in mind this does not tell us what happens to you. Typically, those aged above 50 can be targeted for risk assessment. However, you can be at risk of developing osteoporosis and osteoporotic fracture if you are under 50 and taking certain medications, like the ones I have mentioned earlier, or you are diagnosed with premature menopause, or already had a history of fragility fracture. In primary care, we routinely consider assessment of fracture risk. In all women aged 65 years and over, and all men aged 75 years and over, in women aged under 65 years, and men aged under 75 years in the presence of risk factors, for example, previous fragility fracture, current use, or frequent recent use of oral or systemic glucocorticoids, history of falls, family history of hip fracture, other causes of secondary osteoporosis, low body mass index, less than 18.5, smoking or alcohol intake of more than 14 units per week for men and women. If you think you are at risk of osteoporosis or have already suffered a fragility fracture, then consider seeking advice on ways to improve your bone health. After taking your history and doing any relevant examination, your GP will use the risk calculator to check if you have a significant risk of fragility fracture. I have put a link in the description below for you to access these tools yourself. If you use the FRAX score, click on the View NOG Guidance button to show a chart that will automatically plot your patient's calculated risk against their age. This graphically represents a person's risk as being at low, green zone, high, red zone, or intermediate, orange zone, risk for an osteoporotic fracture. Based on where you fall, it offers recommendations for action. How do you manage osteoporosis? Prevention and management strategies for osteoporosis often involve lifestyle modifications, nutritional interventions, and, in some cases, medication to strengthen bones and reduce fracture risk. What are these lifestyle modifications? Manage risk factors by stopping smoking, cutting down on alcohol consumption, ensuring a calcium-rich diet, and assessing for vitamin D deficiency. The most useful for the prevention of falls and fractures is muscle and bone strengthening and balance activity. This can improve physical and overall well-being at any age and prevent falls responsible for around 95% of all hip fractures, which cost the NHS over £1 billion per year. Activities found to have the most benefit for muscle and bone strengthening include ball games, racket sports, dance, Nordic walking, and resistance training exercises. Signpost patients to these exercise services within their community. With the help of social prescribers, you can find which services suit you best. Your GP can also refer you to a community physiotherapist and occupational therapist to support you in various fall prevention strategies. How is calcium involved in bone health? Calcium is an essential mineral in the body. Most of it is bound to our bones. However, a small quantity is useful in blood clotting, in our muscle activity, and in the electrical activity of the heart to keep it pumping. Our bodies are not able to make calcium, therefore we need to take them into our bodies as part of the complete diet, or sometimes as supplements. Bear in mind, calcium intake is not a treatment for osteoporosis, but in addition to other factors like vitamin D and exercise, it contributes to having a healthy bone as you get older. We will talk about vitamin D in a moment. I have put a link in the description below that goes into detail on how to calculate daily calcium intake. It also has great advice on food sources of calcium. Remember, most people can get all their calcium requirements from healthy, balanced food instead of taking supplements. The daily recommended intake of calcium is about 1,000 milligrams per day. If calcium is taken in excess, it can predispose to kidney stones, abnormal rhythm of the heart, muscle pain, and bowel dysfunction. What about vitamin D? The UK Department of Health and Social Care recommends that adults and children over 4 take a daily supplement containing 10 micrograms or 400 international units of vitamin D. This is because we do not get enough sun most months of the year to make our own vitamin D. Most people can take this regularly to maintain their levels for building healthy bones. However, as an independent treatment, it does not prevent a fracture. Seek advice from your GP before taking higher doses. In a study on community-dwelling adults, there is no benefit from taking vitamin D to prevent fractures among older adults in the community. However, among the elderly living in care homes, there is a benefit in supplementing their diet with vitamin D to prevent fractures. The number needed to treat is 36. That means that 36 people will take vitamin D to prevent one hip fracture. The avoidance of hip fractures is immensely important in an elderly person living in a care home or nursing home compared to the possible harm of kidney stones or kidney insufficiency. What about bisphosphonates for treating osteoporosis? If you are diagnosed with osteoporosis and you are at intermediate or high risk of fragility fractures, treatment with bisphosphonates reduces your risk of fracturing a hip or fracturing bones in your spine. It has not been shown to make a difference to your risk of fracturing your wrist or arm. Furthermore, there is a subgroup analysis that showed that bisphosphonates, the bone-sparing medicines, do appear to reduce fractures among women with very low BMD and those who have had previous fractures and should be considered. However, in those without very low BMD or fractures, no study has demonstrated a true benefit. There is evidence of harm in terms of serious side effects such as atypical fractures and osteonecrosis of the jaw and gastrointestinal, musculoskeletal, and other side effects. Although you are much less likely to have a vertebral or hip fracture if you have bisphosphonate treatment, this could still happen. Also, many people with osteoporosis will not fracture a vertebra or hip bone whether they have bisphosphonate treatment or not. It is not possible to know in advance what will happen to any individual person. The chance of you benefiting depends on how likely you are to have a fracture anyway, known as your baseline risk. For example, if your baseline risk is 10% on average, for every 100 people at this baseline risk who have bisphosphonate treatment for at least 3 years, over 10 years. About 90 people will not have a vertebral fracture and would not have done anyway. About 5 people avoid getting vertebral fractures because they have bisphosphonate treatment, and about 5 people get vertebral fractures even though they have bisphosphonate treatment. Similarly, for the effect of bisphosphonates on the risk of hip fractures, with a baseline risk of 10%. On average, for every 100 people at this baseline risk who have bisphosphonate treatment for at least 3 years, over 10 years, about 90 people will not have a hip fracture and would not have done anyway. About 3 people avoid having a hip fracture because they have bisphosphonate treatment, and about 7 people have a hip fracture even though they have bisphosphonate treatment. What are the side effects of bisphosphonate treatment? The most common side effects include heartburn and indigestion, pain or stiffness in your muscles, joints or back, headache, and feeling tired. Not everyone gets these side effects, but they may affect around 1 person or more per 100. People who have bisphosphonate injections can get symptoms like flu for a few days afterwards, especially after the first injection. Less common but serious side effects include ulcers of the stomach and esophagus, unusual fracture of the thigh bone, this is rare, and damage to the bone in the jaw and ear, this is also very rare. This decision aid is only a guide. It is not possible to know in advance what will happen to any person. In this video, we have covered factors that improve bone health. Eating a healthy balanced diet, resistance and balance training activities, supplementing vitamin D levels to maintain body stores, and if appropriate medication to strengthen bones and reduce fracture risk are integral to a holistic approach to keeping your bones stronger for longer. Thanks for watching. Don't forget to like, share, and subscribe to our channel for more educational videos.